Welcome to Conversations here on NTA Network. My name is Nike, and as you know, Conversations, we have been celebrating womanhood for weeks now, and we'll still focus on that today. We're talking about a bit of women's health, and we have another expert in the house. But first, we'll do some introductions.
Hi, my name is Farida Haruna, and it's an amazing time to be here. It's amazing to be here.
Good to see you again, Farida. Yeah. Sir?
Hello, viewers. My name is Dr. Christopher Otabo. I'm an orthopedic surgeon.
All right, sir. Thank you for joining us here in the conversation room. Well, I'm sure a few of you may have seen the promo for today's topic. We're going to be talking about autoimmune diseases. That's when your own body fights back on you or fights back at you. So we'll take a quick feature and we'll be right back in the conversations room. Stay with us.
My name is Susan, and I am a young, hard-working urbanite. I do a lot of things to make money. I swear it is all legal. Some days are harder than others, but my hustle must continue. I love to dress up, especially with my heels. They help my hustle, or so I thought. One fateful day, I woke up with a sharp pain in my body. I thought it was just the stress of hustling, so I took paracetamol and I moved on. But I noticed the pain lingered, especially in my joints. As the days went by, it began to spread. I started getting weak, especially in the mornings. But to be honest, this pain is not new to me. It first started when I was in SS1, and it has continued to this day. The pain is present in my knees, my elbows, my fingers, and my hips. It hurts more at night and when the weather is cold. Daily it gets worse, and my fear deepens. Alas, I went to see a doctor, and I was diagnosed with osteoarthritis. It was a big name with no meaning, but the doctor explained that it's a type of autoimmune disease where your joints become inflamed, which causes pain and soreness, and it gets worse with age. The explanation provided no relief from the pain, and I felt it would eventually kill me. I thought I would die before I could really experience life. Sometimes the pain gets so much, I would spend nights crying and howling in my room. If the weather was cold, my knees and my fingers would become very stiff, and it would be very hard to move them. The doctor explained to me that there is no cure for arthritis, but with good management, I can live with it. He gave me medication, he told me to eat better, and he told me to lose weight. That on its own was a chore, given that I needed to exercise with the bones that were already paining me. But if I did not follow his instructions, my arthritis would become worse, and I would need surgery in the future. Slowly but surely, I began to exercise, and I changed to a much healthier diet. My compression socks are my daily companions now. More than anything, I'm determined to live. I only wish I was wiser years back. Perhaps I would have done things a little bit differently.
Wow, so just watching that feature, it struck a nerve for me. I don't know about you, Farida, because there are so many conditions just like that are autoimmune diseases, and it seems like you can't really do much, but you need definitely medical intervention and, medical advice. It's not something you can do all on your own. Dr. Chris, so could you just start with the basics and tell us more about autoimmune diseases? I mean, it's self-explanatory in the feature, but we'd like to hear from you.
Okay, thank you for the opportunity. Normally the body has a defense mechanism, and that defense mechanism helps the body to identify foreign invaders and fight them off. So when you have bacteria come into the body, viruses or other substances in the environment, the body's defense mechanism is triggered, and there are specialized cells that helps to engulf those organisms or render them ineffective and throws them out somehow. Unfortunately, in autoimmune diseases, that mechanism, that defense mechanism, is turned against the body cells. So that mechanism begins to recognize some tissues in the body as though they are foreign, as though they are the enemy. And so the body defense system, the cells, they begins to fight a self-destructive war.
Right.
Yes, they begin to attack the joint tissues, that is rheumatoid arthritis, sometimes the thyroid, as in case of Graves' disease or Hashimoto, Thyroiditis. These are big names, but don't worry, they are just specific terms.
Okay.
If it affects the kidneys, like in lupus, you can have lupus nephritis, even the muscles. Different organ system can be affected. So autoimmune disease is not one disease. It's a combination of many diseases, depending on the symptomatology and the organs that's affected.
Can someone have more than one autoimmune disease?
Yes, but the truth is that one is usually more than enough trouble. So if you have more than one, yeah, it's possible. Yes, but most of the time there's a particular pattern.
Okay.
So you have rheumatoid arthritis.
Okay.
It's a particular pattern. That disease entity has a lot of symptoms. Most of the joints in the body takes the hit, and all that. Then you have systemic lupus erythematosus, what we generally call the lupus.
Okay.
That is is autoimmune disease that affects many organs: the skin, the lungs, the heart, and the kidneys. So you also, even psoriasis is a particular type of skin manifestation of autoimmune disease. So there are a number of them, quite a lot. So is there a possibility for a combination? Yes. Some people do have them, but like I said,
one is enough, but having two is terrible.
Yes.
And does diabetes fall under this category?
Yeah, there's a particular type of diabetes, type 1 diabetes.
Okay.
There are two types of diabetes, type 1 and type 2. Type 1 is common in younger people, and it could be a result of the body cells attacking the insulin producing cells in the pancreas. Yes, in that case, yes, type 1 diabetes a lot of the time is as a result of an autoimmune condition. Yes.
Okay. I know you mentioned rheumatoid arthritis, and back then when I was growing up, there was rheumatism and then there's arthritis. Is it that it's a more modern term to call it that?
Well, rheumatism is more of a colloquial language. It's not known to medicine.
Oh.
Yes, it's just let's say a lay language for certain kind of pains in the body.
Yeah.
Yes, but rheumatoid arthritis is a specific disease entity that has various diagnostic criteria.
Okay.
Yes, you have to see certain signs, and then most of the time it's a diagnosis of exclusion. But as it progresses, then it becomes more obvious when the signs and symptoms become more florid.
Okay.
Yes.
And is it from a certain age?
I was going to ask that.
Yeah, in terms of age,
So that we
yes. Like I said, in terms of the sex predilection first, about 80% of patients are women.
Wow.
Yes.
Why? Sorry.
Yeah,
I'd like to know why.
Up until now, there's no definite reason. So research is still going on, but it's thought that because of the hormones, women have a lot of hormones that gives them that look as a woman. So it's thought that the hormones are responsible. Some school of thought say maybe because of the disproportionate fat.
Yeah.
Women have more fat in their system than males.
Okay.
Yes, but nobody has been able to clinch the exact reason why. These are just postulations. Then also, we were talking about the age.
Yeah.
Yes, so it's around the age of 40 that it mostly manifests. Just before or around the age of 40. Yes, and it's also commoner in bigger women. Yes, and overweight people. Then people with family history of rheumatoid arthritis.
So it can be genetic.
Yes, but the genetic aspect of it is not as straightforward as, oh, you have this and therefore your child will have it.
Okay.
Yes, because there are a lot of members of the family that will not have it. So there's incomplete penetrance. In other words, I can have rheumatoid arthritis, I have 4 kids, maybe 1 or 2 would have it.
Wow.
But if there's a family history, the incidence is higher than in people who don't have family history.
Interesting. So the lady in the feature talked about needing, or if that there's a possibility that she might need surgery. Can you tell us a little bit about that? Why would she need to have surgery?
Okay, so for rheumatoid arthritis, as the joint destruction continues, there could be secondary changes in the joint, like deformities. You see someone who had straight legs before, she's now having knock knee, what they call K-legs, or bow leg.
Oh, that can happen later in life?
Happen?
Yes, it can.
From straight leg to K-leg?
Yes, as a result of degenerative changes in the body, in the joint. So that then also the joint cartilages can be eaten up, and if that happens, it will now lead to osteoarthritis. So rheumatoid arthritis can lead to osteoarthritis, and once the joint is damaged beyond repair, then the only option for that joint is to be replaced. So she will require a joint replacement operation, where that joint is taken out and an artificial joint is put in place. That will take care of the pain. It will remove any deformity.
That's like the hip replacements that we hear.
Yes, like the hip knee replacement.
But the people that usually have these things are quite, I mean, when I hear the hip replacement, I hear people over 70 needing those kind of things.
I do knee replacement we have done for a 15 years old.
Yeah, that's what I was going to say.
Yes, sickle cell, exactly.
Yeah.
It's as occasion demand.
Yeah.
So in younger people, you have it in people with sickle cell, people with Pettis disease, other forms of diseases that occur in childhood. In rheumatoid arthritis can start around the age of 35-40. But the patient may not require knee replacement or hip replacement until around 50s or 60s. So it depends on the trajectory of the disease, depends on the natural history and the pattern, because some are slow, others are more aggressive. So there's no hard and fast rule as in when this patient will require surgical intervention. Yes, some may never even require. Yes, so it depends on the severity of the disease.
You talked about genetics. So if I already know it's established in my family history, or my parents have a certain autoimmune disease, is there anything I can do early on to prevent it manifesting?
It's just general measures like being regular on exercise, eating healthy diets, and avoiding bad harmful lifestyle like alcohol, cigarettes, because these ones, they can make it show up in time or make it worse. And then you also have to control your weight, because the bigger you are, the higher the chances that you are going to come down with florid features of the disease.
There was a time a woman was saying, if I sit underneath the AC for a long time, maybe it will affect me in the future, because whenever you use cold and everything, it might affect your joints and everything. So I didn't understand why she was saying that. She was like, this will affect you when you're in your 40s or 50s. Reduce the way you use the AC, use fan and everything. And I'm like, why?
Well, not necessarily. There are people who live in the temperate region.
Yeah.
And I mean, temperature of minus something.
Yeah.
When we go on holidays abroad, sometimes we do 5 degrees, 2 degrees,
Yeah.
and there are people who live there naturally.
Naturally.
So, but the reason why cold is
Affect the
deleterious,
joint.
yes, is because it can amplify symptoms of a disease that is already there.
Okay.
Yes.
Okay.
Yes, it can make it
It
worse.
can trigger it, push it.
Yes, the cold, it leads to vasoconstrictions.
Yeah.
And when the blood vessel is constricted, so there's no free flow of blood to that area. And so once there's vasoconstriction and there's no enough blood flow at that time, it can lead to pain and
Yeah.
stiffness and all that. But that should be momentary. Yes, but in terms of use of AC, just do what works for you.
Yeah.
There are people that they can stay in the AC for hours on end and they are fine. And some
there are people
within
that-
minutes
yeah,
they have to make adjustments.
Yeah.
So just do what works for you.
It's like a lifestyle. Just
Yes.
do the lifestyle that works for
Yeah,
you.
do what
in
works for you.
general.
Yes.
Yeah.
Doctor, could you throw some light on multiple sclerosis? I hear about it a lot when I watch movies, medical dramas, but I don't seem to see many people talk about it here.
Yeah, the reason is because it's not a common disease in this environment. It's
Okay.
commoner in the West.
Right.
And it just like people hardly talk about malaria in the US or
Yes,
in
yes.
Europe.
Yeah.
Because if you have a case of malaria in Europe, they will call a conference. The doctors all will gather together and interrogate.
serious?
Yes, sometimes they may have to send your blood sample
I heard
somewhere
malaria
to do a
killed
test.
a woman in the UK, and I'm like,
Yes, because
Wow.
because it's not common, so it's strange. So the same thing, multiple sclerosis is an autoimmune disease. What happens is that the body defense cells, like I explained before,
yeah,
will begin to attack certain organs in the body. It's called multiple. Multiple is self-explanatory. Sclerosis is thickening. When you say something is sclerosed in the body, it means that part of the body has become thick.
yeah,
So multiple sclerosis, you have thickening of the skin, you have thickening of the heart muscles, you have thickening of the lungs, you have thickenings of the skeletal muscles. Everywhere is just hardening up. The individual is freezing up, and so because of that, our skin is supposed to be pliable, but it becomes thick like that of like you have
So it's a leather.
yes, or leather. Yes. So
Right.
so it's going to be a problem. Even walking will be a problem, and the problem with multiple sclerosis is that it's progressive. Yes. So it will get to a time when the organs will begin to fail, because what manifests outside in form of thickening of the skin also manifests inside. So the organs begins to fail, and eventually it might lead to end of life.
please, what are the early symptoms? Because what you're saying is really scary, and we and the viewers at home need to know what we should look out for. Even the smallest.
First of all, it is very, very rare,
Okay.
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 extremely rare. So, especially in Nigeria,
Okay.
Okay.
you can't, you just don't think there. if there's going to be a diagnosis of multiple sclerosis, it's the doctor that will discover it, and it's a diagnosis of exclusion. So it's not what you come by. Maybe in the whole city you may not have more than 5 people having it.
Okay.
So don't let your mind go there, because you simply have something on your skin. This thing is generalized.
Okay.
Yes, and you just feel unwell, and you just know that something is happening and your life is probably ebbing away.
Wow.
Yes, but even at first, when they come to the hospitals, doctors' minds will not even go there. So it's as the disease progresses, then more florid signs will be showing up, and that's the same thing with most cases of autoimmune disease. They are hardly ever diagnosed at first.
Yeah, I was going to say, how do you
Yes.
even take tests, and how do you
Yes,
diagnose
sometimes it takes years before it will click that what we are dealing with here is an autoimmune
So it
disease.
keeps building up in the body till whenever it decides to show.
Yes, it keeps, the changes are slow, gradual, but very steady.
Okay.
Yes, it keep manifesting, sometimes it just presents as general body pain, then it now localizes to the joint, then there will be weakness, early morning stiffness, depending on the type of autoimmune disease. Yes, fatigue, and so on. And for those that affect the internal organs, the heart will be failing. You can't climb stairs, when you climb stairs, you are panting.
Wow.
Little exercise is causing you stress. And then those who have kidney manifestation, they'll begin to, their kidney function tests begin to become deranged. And maybe the kidney urine output is getting less, So those are the things that then sometimes some people have shortage of blood. There's anemia. You do your complete blood count, discover that it's lower than expected for that person.
Wow.
Even though the person did not lose blood, no accident, and is eating. So those are some of the things that makes you to become suspicious.
Okay. Doctor, is there any relationship between wearing high heels and arthritis? Because the lady in the feature story talked about heels. So I don't know should we wear heels, shouldn't we? That's a our mothers listening to us now will be like, yes, don't wear heels.
Don't wear heels.
Or you and I would still want to wear heels.
Wear heels.
Even if there was, many ladies would not stop wearing heels.
I know. I'm looking when she spoke about heels, I had to look at my leg. I'm like, I need to stop.
There's really not an issue with heels.
Okay, what about pregnant women in heels?
Pregnant women.
It's just not safe because the tendency to fall is higher. Yes, you can twist your ankle. Yes, falling is more. People are more pro. So it's advisable for pregnant women to go on flat shoes.
Okay.
Yes.
What are the common autoimmune diseases that you see regularly,
in this environment?
This environment.
Okay, so rheumatoid arthritis is the commonest that we see in this environment. Then systemic lupus erythematosus is increasing now. Is increasing.
Sorry, break that down.
Lupus, systemic lupus.
Okay.
Erythematosus is just the redness. You find some people, they have this malar patch, like butterfly rash here. It's one of the telltale signs of systemic lupus.
Wow, thank you very much.
Yes, it's not, I mean, you don't just see it on a lady that is enjoying her life and you say, when the person is sick, and then you now see,
seen it once.
Yes, you see it. Yes, that's a diagnostic feature of systemic lupus.
Right.
Yes, so systemic lupus, rheumatoid arthritis, Graves' disease is an autoimmune disease. Where the antibodies are now that the body produces, the soldiers is attacking the thyroid gland.
Wow.
And it causes it to produce more thyroxine. So you find some people, their eyes are bulging. And the white, normally the white part of the eye does not go beyond the margin of the black.
Yes.
But this one, you just see the black at the middle. Every other place white is exposed.
Wow.
So that's Graves' disease.
Right.
And sometimes they have swelling in the neck.
Okay.
So that's a diagnostic sign. You can know that this person has Graves' disease. Then even on the other extreme, Hashimoto's thyroiditis is a type of thyroid problem, autoimmune disease where the cells that produce the thyroid hormone are being attacked. So you have very low thyroid hormone production. The person is slow, is had so much weight, and extremely cold intolerant.
As you even said, one disorder is enough, because you said a lot. Just imagine somebody having
more than one.
A lot.
Yes. Then of course the type 1 diabetes is also a type of autoimmune disease.
I like the fact that you focused on lupus, because that has been, in social media a lot because of the Nollywood actress Kemi Afolabi, who's brought quite a bit of awareness to it. Is it truly possible for a doctor to give a timeline, a benchmark in terms of years on how long someone will live based on these conditions?
Based on the person's condition.
Yes, because someone will tell you you have 8 years to live, and you're like, no, I reject it.
Well, to reject it is, first of all, to put your faith to work, and secondly, to also get the best care. But even in the best care, medically speaking, to a large extent, we can in certain cases. I'll give you an example. 2020 March, someone came to me who had a breast cancer, very close person. So the cancer had spread a little, and so a close person to the family, a kind of family member, asked me, "Doctor, what's the hope?" I said, medically speaking, this lady probably has 2 years to live, and the lady died March this year. Exactly 2 years.
Wow.
Yeah, that was a little bit too specific, maybe, but many times you can give a time frame and say plus or minus. Yes, they can surpass, or it may not get there.
You might not even get the Africanness in us. Is it something that you do? Is it something that people don't want to hear that?
People don't want to hear that.
Is it something that you have to
it's cultural. It's cultural. People don't want to hear that, and sometimes, most times I don't do that as a doctor, except it coming from the patient or their close relatives.
Okay.
And I'm not going to tell you this. I will tell you, well, given XYZ that I can see, most people that have reached this stage, this is how long that is left.
Right.
So it's helped people to put their house together. Yes, if there are quarrels, you want to settle them. If you are not right with God, you want to put yourself right with God. And then if you have a will that you want to, like for instance, if someone comes in with metastatic cancer of the prostate that has spread to the spine, and you have done the first stage of treatment, which is hormonal treatment, and is recurring, then the person should start packing his bags. You don't have too much time left.
Wow.
So those things we do it, but for that of the lupus, well, I don't know. I'm not seeing the patient. I don't know what the information available to the doctor is, because the fact that someone has lupus does not mean that it doesn't have other diseases. Someone can have SLE and have HIV at the same time. So they both complicate each other. Someone can have lupus, and the doctor has seen that the kidney function test shows that 80% of the kidney is gone. So that is also a diagnostic, is a prognostic criteria. So I can't comment on that because I've not seen the patient. But it's possible to hazard a guess as to how many years one might have remaining based on certain medical condition.
I have a message saying, wow, this program is a wonderful one. I'm enjoying it, and it really helps, because there are people watching and probably have relatives who are like, oh, this kind of sounds familiar. So doctor, for instance, if someone wakes up and has a tingling in their hands and feet, is that a bad sign? I'm not talking about pins and needles, that's different, but that tingling.
There are many possible causes of that, and it also depends on whether it's transient or whether it has come to stay. Yes, sometimes we feel some strange signs in the body, and it just passes away almost immediately, and you move on. But if it's persistent, then we begin to ask some probing questions. First, you want to know if the patient is diabetic, because that tingling is showing that the nerves are complaining. Okay, so diabetes can cause nerve complications. We call it neuropathy. So there will be tingling. Some people will feel as though there's pepper on their hands and feet, and so on. So then also nerve compression from the neck can cause numbness and tingling in the hands and feet. Okay. So there are many possible causes. If it doesn't go away 1 day, 2 days, then it's better to go to the hospital for a check to know what is going on.
Well, speaking about checks, we're going to sample some opinions of some of our viewers on what exactly autoimmune diseases are and their perceptions about it. We'll be back.
you have medical checkup frequently. You must not be sick before you go for a medical checkup. Something can be wrong with you and you will not feel pains. But I think when you go for a medical checkup is when you know that, okay, there's something wrong with me and I need to treat it.
I can't remember when last I had that. Because I'm very busy, always busy doing things, and so I don't even have time to even go for checkup.
It's actually good, because if you go for medical checkup regularly, you know your state of health and your well-being, you know. There are some sickness that actually hide within the body. They don't get to show unless you go for medical checkup. They will do some tests for you. Then they will see that you have this sickness. And it's actually good for you to discover your sickness on time so that you treat it in good time before it's extended to some other sickness, you know. Like I said, you see, Nigerian, but we they believe say we strong, they can't pay, say nothing they do us, say we be, but it's a lie.
At least maybe twice or 3 times in a year, you're supposed to like go for regular checkups. Like for ladies most especially, you know, sometimes like for us students, we easily get infected through public toilets and all. So you going for regular checkup will help you to know if you are infected or something, because sometimes this infection of a thing does not really show. It only shows later on. But if you do a regular checkup, you get to know if you're infected or not, and you'll be able to treat it on time.
Only people who are knowledgeable, you know, will think it is good to go. But then, if you go to, let's say, my village, and you ask them to go for a medical checkup, they will ask you, what is medical checkup? That's just it. You and me know exactly that it is good to go for medical checkup regularly, and that is why you and me will go.
When there's a child out there that's not getting the same that your own child is getting, the difference will tell, and there will come a time in the society where that child is going to take its pound of flesh.
Where you can actually, everything from watching a program with the child, you can start up the conversation from something on the TV and say, oh, you know.
For me, it's like, hurry up with this business. And the other one said, Auntie, it's not about me, it's about the guys, they're not ready to marry.
Yes. If she wants to ask something, no, I know my mother very well. In fact, the most interesting one is when I put up pictures on WhatsApp, you know, Snapchat filters and all that, she will call me, remove that picture. There was a day I got tired of all that and I said,
Interesting opinion on getting medical checks, which is very important. People say, oh, you should get it done, but some people actually don't. I know you had a question for the doctor.
Yes, doctor, I have a question. I heard that, I have noticed or seen people, when they tell them they have arthritis or something, they'll prefer to go to a herbal doctor that would draw bad blood or dirty blood or do something for them instead of going to a doctor. And in the northern society, where we have lesser educated people most of the time, they'll rather go to a native doctor or somebody that can pull horn at the back and just do something for them and make them feel better. But they don't even get better, but they still go back and go back and go back. So what can you say about that?
Well, I'm happy that the answer to the question that you asked is actually in the question, because you said that they don't get better. You know, medicine, there is psychology in medicine, but at the end of the day, the facts will speak for themselves. Those who are sick, there's only an extent to which they can deceive themselves. So my experience is that after all the rigmaroling around the traditional folks that are said to be drawing bad blood and all that, they still end up in my clinic and in some instances on my operation table, where we'll have to do the needful. I don't criticize, I'm not against traditional medical practice, but even in the traditional medical practice, there are also bad practices within it, and that we must kick against so that people can be safe. This issue of drawing bad blood from the knee in order to get relief, it's complete nonsense. It doesn't work. What happens is a distractive therapy. Okay. When you cut around, you create some scarification around the knee. Okay. It causes pain naturally. So that pain will temporarily mask the original pain that's in the knee. Okay. But at the end of the day, when the new pain is gone, you are back to square one. They're always doing it. They're always moving from place to place. Yeah. So that means that it doesn't work. You know, then tying the horn around the body that's like witchcraft. And it's not provable. So we only talk based on facts. We work based on something that has been proven or that can be proven. Yes.
Doctor, you have a question here. I love this program. My sister has an autoimmune disease, hardening of the skin and white patches on her body. Wow. All her hairs are gone for more than 20 years. Please, how do I help her?
Wow, she has psoriasis. That is an autoimmune. Yes, where there's thickening of the skin and a loss of coloration, white patches. I want to believe that for her to be alive for 20 years, it means that there must be some level of care that she has received. I don't know this current state of her sister, but the sister should continue to do what she's doing because it's working. And see a rheumatologist. A rheumatologist is an expert. His specialty is in autoimmune diseases. Yes, though there are very few in the country, and that's the reason why many of us orthopedic surgeons have tried to bridge the gap because there's a big portion of rheumatology in orthopedic surgeon, orthopedic specialty. So we can't advise her from here because even if I have 1 hour, it's not enough. So she should go see a doctor, an orthopedic surgeon, or a rheumatologist who would, or a dermatologist. Yes, usually autoimmune disease is actually a multi-specialty treatment. Many specialists come together to help patients.
There's another one that sticks out to me. It says, I'm having numbness in the left part of my body, and most times I have headache also in the left part. I don't know if that has anything, but what are your first thoughts on that when you hear?
When you say left part of the body, we also want to know, is it the entire left half or left arm or left leg? Because the body is segmented and the brain has its role, then the nerves also have their role. So if one is having numbness on the left upper limb, then we are probably talking of a nerve compression. If it's in the left lower limb, we are talking of a nerve compression from the waist. So, but just the whole half of the body, except we are talking about something like a mini stroke or something, but we don't know how long. So it needs to go to the hospital so that we can check.
Okay. There's a lady here that says she was a nursing mother. The baby is 4 years old now, but the flow has refused to dry.
The breast milk?
Yes.
Okay.
And that she also has pain. Is that a sign of an autoimmune disease?
No, that's not a sign of autoimmune disease.
If it's still flowing?
No, it's not a sign. So it depends. If the baby is still suckling, then the breast milk will continue to flow.
He's 4 years old.
Yeah, no, some people suckle till much later.
Yeah, but not Africans. I think Africans might.
You try to.
You see, as long because the process of breast milk is a vicious circle. Okay, when the baby suckle, it stimulates the brain to produce more breast milk, and it continues like that. Some people are in school and they are still suckling. So if the baby is still suckling, get the baby off the breast, then that can stop it. But if you have done that for some time and the breast milk is still coming out, then we have to now start looking at the hormones. Because there's a part of the brain that produces the hormones. If that part of the brain has a tumor, it can continue to produce hormones even when there's no stimulus from the breast.
Yeah, they say Google is your friend, right?
Yes.
And
I'm sure doctor will differ. Is Google really our friend?
Is Google really our friend? Because if I have any symptoms, I Google just to know what. And also, before you answer that, since Google is, I don't know whether he's our friend or he's not our friend, but whenever maybe you have numbness or fatigue or pains in the joint, when I Google, they'll give you like home remedies, something to do. So, is Google really our friend?
Yes, Google is our friend and at the same time can be our enemy. So, we have to use wisdom in all these things. There are a lot of patients that come to me with a mindset. Because they've Googled so many things. Yeah. So when I receive patients, I want to know what they know first. Yes, and it's not like we are not in a competition. Because if Google could treat you, I'm sure you would not even show up. So I want to know what you know. Yes, and then because you know what Google is. If you write nonsense now and post it,
someone
can Google you in US and start reading the nonsense.
Yes.
So it's not controlled. It's anybody's thought that is putting. Some people Google will tell you if you want to lose weight, drink early morning urine. Rubbish. So there are a lot of nonsense out there. Yeah. But there are some that make sense. And then even when something makes sense, you may not really know how to apply it to yourself. So I want to hear from my patients, what do you know? Okay. Then the ones that are correct, I will agree with the patient. The one that is wrong, I would explain to the extent to which it is wrong and see what we can do to properly situate them with respect to what problem that they have. Because my role is to help you. And you are the one that is sick. Irrespective of the information you have already received. But if you still came to see me, that means you still need my help. Definitely. Yeah, so it's not a quarrel, it's setting things right. Okay. Yeah, so if you have pains, there are some home remedies, yes, like cold compress, warm, compress. Okay. Those are traditional practices that have helped in the past. Okay. Yes, so we may just now take it one step further.
I like the fact that we're talking about home remedies now, because we have a question that says, I was told that drinking warm water with lemon or apple cider vinegar first thing in the morning can keep me away from diseases. Doctor, your thoughts?
Yes, warm water with lemon has a lot of usefulness. Okay. Yes, and even the lemon flavor in water helps us to drink adequate quantity of water. That's if for nothing. That's one of the useful. Wow. Yes, because it makes you want to drink, because drinking adequate water is one of the good health practices.
That's very interesting.
Yes. Yes. So lemon water has its own benefits. Yes, okay. I agree with that.
Okay, awesome. I feel pains when I pass out urine for over 5 years now. I have done everything medically possible. What do you think I should do next?
Okay, we also need to check his habit of urination, because if you hold urine for too long, when you are going to the loo, you will definitely have some pain, because the sphincters are inflamed now, the valve that helps to close the bladder from stop urine from coming out. Yeah. So it's I took note of the fact that the writer said that he has done everything medically possible. Yes. That means that they probably have ruled out infection and some other things that I would have wanted to mention. So maybe he needs to see a urologist. That's the expert in water works in the body. Okay. So to see what is missing. There may just be one thing that is missing, but in some circumstances, no matter what you do, it is what it is, and you have to live with it. Yes.
You had a question on a kneecap replacement. I think I've lost it along the line. Okay, so please, I broke my... Good morning, sir and Maz. Please, I broke my left knee and can no longer bend it backwards. What can I do for over 20 years now?
Oh. Wow. What a life. 20 years.
It didn't heal properly.
Yes, that's one of the problems we have with traditional bone setters treatment. If you have a fracture even if you didn't go anywhere and you can just hold the legs together and stay at home, the fracture will unite. Okay. Yes, the fracture will heal. That's what people don't know. A lot of people think, oh, the traditional bone setters are doing something special. No. If I break my bone and I'm able to keep it in one place and hold it in one place long enough, most of the time it will unite. Okay. But the question is, when you visit these people, in what way would it unite? Sometimes the bone has united, but her doctor say, I can't do like this. That's one of the complications. And that's where we come in, you know. So we want to make sure that when you have a fracture, we give it the best chance to heal and with the least possible complications. Many times, when you have a fracture around the knee, though it's on the bone, but if it is close to the knee and it extends into the knee joint, that's a big trouble in the future. It might unite, the bone might heal, but it will lead to stuff like this. You can't bend the knee, or later on you have arthritis within 1-2 years, because the integrity of the knee joint has been breached. The knee and the ankle joint, they are very unforgiving joints. You mess with them, you are going to have a problem for a long time.
The knee and the ankle joint.
Yes. So if there's a fracture around there, please don't go to traditional bone setters. You fracture might heal by whatever maneuver, but you are going to be punished severely by the complications that will result from it. So for that guy, I don't know what has gone wrong. We need to see the x-ray, and after the x-ray and the examination of the patient, we will advise accordingly.
Okay. Good morning, doctor. I've been battling with rheumatism for some years now. It moves to different parts of my body and gives me swellings. Recently, I got severe pains on my bones and left shoulder, and peppering feeling on my right leg. So what should I do?
Well, I don't know. She said she has had it for years now.
It's moving.
Yes.
It moves to different
we
parts
call
of
it
the body.
fleeting joint pain. It's part
Fleeting.
of, yes, fleeting joint pains. You just move from one joint to the other. Wow. It happens like that, especially the juvenile rheumatoid arthritis, the ones that happens in the younger people. Yes. So this is what we are discussing today. So it's not as easy as saying go and take paracetamol. You know, you need a doctor to evaluate you. There are different treatment modalities depending on the stage. There are medications, there are non-medication treatment. For the medication treatment, there are different types. There's disease-modifying medication. You know, there's non-steroidal anti-inflammatory. There are steroids. So it depends on where you are. Your doctor will give you the type of medication that you need. So rheumatoid arthritis requires some specialist intervention. Okay. Yes.
Do you have a question for him? I was going to ask about bone density, because you mentioned, women, and I know that's a challenge. Sometimes you watch some of these commercials and you see calcium supplements for women, particularly because of osteoporosis. So can you tell us at which point does our bone density start to reduce, wane?
So whatever you need to do to strengthen your bone, you have to do it before the age of 30. Because the graph is like this.
That's not an encouraging thing to tell me right now. That ship has sailed.
The graph is like this. The maximum bone density peaks at 30. Okay. Anything from 30 begins to go down. Then for women, when they hit menopause, there's a sharper decline. Wow. Yes, and that's why you have insufficiency fracture in women who are menopausal and above. They just have a little fall and then they have a fracture around the wrist, hip fractures, and then pain. I saw a patient yesterday who had severe pain in the body. I did the x-ray, the vertebra, the backbone is like biscuit, soft now. Yeah, so that can lead to fall. So in postmenopausal women, we have a challenge because some women, just out of their own constituency, are not able to go through that menopause period without turbulence. And so after the menopause, their bone strength drastically reduces. So it leads to, that's what we call osteoporosis, when the bone density is so low. And that has its own complications.
Yeah.
So it can lead to easy fracture, body pain, and so on and so
How do we
forth.
stop it? How do we...
Yes, so the cheapest way out is hormone replacement therapy, which is estrogen, because the difference between premenopausal and postmenopausal women is estrogen. At menopause, the ovaries dry up. They don't produce estrogen. The reason Farida is looking as beautiful as she is because of the estrogen that she has. Yeah.
But are there foods with estrogen? It's
No,
not like...
it's produced in the body. So when women get to menopause and the menopausal signs are really terrible, many people can't cope, then there's what we call estrogen replacement therapy. You give it to them in form of injection under the skin.
Wow.
Yes, so that just brings back the freshness and takes away the pain, but it has side effects.
Okay.
Yes, some people it's prone to breast cancer. Yes, but
thank God
it's not
side effects, because I know a lot of people want to go and do it.
Now you're saying we need it.
Yes, because I did my project in my medical school. It was on breast cancer I worked on, and it's been found that there's a slight increase in the number of women coming down with breast cancer for those who use hormone replacement therapy as a treatment for.
Thank you, doctor, for all the help and advice. I've learned so many things, especially on autoimmune diseases. A lot of things I knew about lupus and all the others, but not in this not the way the doctor has to shed light on it. Yeah, not as detailed. Thank you, Dr. Chris. Thank you, Farida.
Thank you so much for having me. Thank you
in the
so
Conversations Room. Thank you to all our viewers that have joined us today in the Conversations Room. We'll see you again some other time. Goodbye.